In recent few years, Malaysia HIV case keep increasing. In 2024, Malaysia reported 3,185 new HIV cases, with 90% involving men and 96% driven by sexual transmission. This is something that all of us should concern. So today, let's learn about HIV prevention tips. So, what is HIV? HIV stands for Human Immunodeficiency Virus. HIV affects the immune system by targeting CD4 cells which help the body fight infections. Without treatment, HIV leads to AIDS and make it harder to stay healthy. HIV spreads through specific bodily fluids such as blood, semen, vaginal fluids, rectal fluids, and breast milk. It is not spread through casual contact, sharing utensil, or insect bite. So, how we can prevent this HIV from spreading further? First, know how HIV works. Second, understand how it spread. And third, get tested and stay protected. Now, let's dive deeper to know about the prevention tips. Tips number 1, stay protected and use condom every time. Consistent condom use is a proven, accessible way to help prevent HIV. When used correctly for every sexual encounter, condom create a barrier that helps to stop the exchange of bodily fluids and support healthier communities. So, how to use a condom? First, find your fit. Second, check before you use. Third, store it safely. And fourth, use one every time. So, we should know your status, get tested, and stay protected. Condom also help prevent other sexually transmitted infections, STIs, and unintended pregnancy, support the health of individuals and families and communities. Okay, how about tips number 2? I'll pass it to Wani, your healthcare provider.
Hi, I am Wani and I will be sharing the HIV prevention tips number 2. Tips 2, you should know your status. Step 1, get tested. Step 2, know your status. And step 3, stay protected. Regular HIV testing is a powerful public health action. It helps people learn about their status early, access care sooner, and reduce the risk of passing HIV to others. Testing is quick, confidential, and available at clinics, community health center, and through home testing kit. If you are sexually active, make testing part of your routine at least once a year and more often if you may have higher risk of exposure. Encourage your partner to test too. When we know your status together, we strengthen trust, safety, and community health. Let's move on to tips number 3. For tips number 3, stay protected with PrEP. Pre-exposure prophylaxis is a daily medication for people at higher risk of HIV exposure. When taken as prescribed, PrEP reduces the risk of HIV through sex by over 99% and by at least 74% for people who inject drugs. PrEP acts as a powerful protection. Take PrEP daily for a highly effective HIV prevention through sex or injection drug use. PrEP also can be used as part of simple daily routine. One pill a day can help you stay protected with long-acting options available for some people. Next, you should also get a medical guidance. Talk with a healthcare provider to see if PrEP is right for you and to stay on track with regular checkups.
Hi, I am Ina, your healthcare mascot. Despite PrEP, we also have PEP. So what is PEP? PEP is post-exposure prophylaxis. PEP is emergency HIV prevention after a possible exposure. PEP may be recommended after condom breakage, needle stick injuries, or unprotected sex when HIV status is unknown or positive. So what do you need to do if emergency happen? Act now. Seek care immediately after a possible exposure. Don't wait. PEP works best when started within 72 hours. Get expert support. Contact a sexual health clinic, urgent care, or emergency department. PEP is an emergency backup, not routine prevention. Use condoms, testing, and PrEP as part of a stronger, community-wide approach to HIV prevention. Okay, it's time for me to say goodbye. For next tips, let's listen from Yi and Hoong.
Hi, I am Yen Hong. I will explain the HIV prevention tips number 5. Tips number 5 will be stay protected and stop the spread. Harm reduction saves lives. If you inject drugs, Using sterile equipment every time helps prevent HIV and other blood-borne infections such as hepatitis C, protect your health, and protect your community. How can we stay protected and stop the spread? Firstly, never share needle. Use a new sterile needle and injecting equipment for every injection. Needles, syringes, hookers, filters, and bottles should never be shared. Second, use harm reduction services. Access needle and syringe programs and harm reduction centers for sterile supplies, safer use support, and no judgmental care. Thirdly, get support early. Connect with treatment services, counseling, and peer support to reduce risk, improve well-being, and strengthen long-term health. Get tests regularly, use sterile equipment, and reach out of support early. Small actions will make big difference for you and your community. Let's listen the next tips from Ding Xuan.
Hi, I am Ding Xuan. The tip number 7 is to talk openly and stay protected. Honest conversation about sexual healthy help prevent HIV, reduce stigma, and support healthy relationship. Talk with your partner about HIV status, testing history, and prevention choice before sex. Know your status, get tested, and stay protected. So how can you actually do that? First, start the conversation. Choose a private, respectful time to talk about sexual healthy with confidence and care. Know your status, share your HIV status and testing history honestly, and encourage your partner to do the same. Get the tested together. Make HIV testing part of routine care and support each other in knowing your result. Stay protected. Agree on prevention methods that work for both partners, including condom and other HIV prevention options. Open communication protect partner, strengthen trust, and support community health. Speak out, get tested, and make safe choice together. Okay, let's go to tips number 8. So for tips number 8, it is pretty easy, which is educating people about HIV as education saves life. Knowledge is a public healthy tool. Learning how HIV is transmitted, prevented, and treated help people make informed choice, protect their healthy, and support their community. Get the facts from trust sources, healthy care provided, public healthy agency, sexual healthy clinic, and reputable online resource. Accurate information reduce stigma and strengthen prevention for everyone. So spread our knowledge to others. That's all for me.
I'm Yaya, so we should know our status and stay protected. HIV prevention works best when it is proactive, informed, and consistent. Using condom, getting tested regularly, and considering pre-EP, pre-exposure prophylaxis when it fits your needs are proven ways to protect your health and support the health of your partners. Prevention is a shared responsibility that strengthens the whole communities. Stay connected to sexual health service, keep up with the routine testing, and learn about the latest prevention options so you can make confident choice for yourself and the people you care about. Remember to get tested, protect each other, and know the facts. Take actions today. Talk to your local sexual health clinic or healthcare provider about testing, pre-EP, condoms, and other prevention options. Knowing your status and staying protected help keeps you and your community healthier. Bye-bye!